Have you ever wondered, in our world of advanced medical science, how a largely preventable disease like cervical cancer still poses such a threat? Today, we're delving into the complex world of cervical cancer, a disease often silent in its early stages. It's caused predominantly by certain types of the human papillomavirus, or HPV. But here's the good news. It's largely preventable through HPV vaccination and early detection via regular screenings. Despite this, it remains a significant health concern worldwide. The question is, why? Let's delve deeper into the symptoms to understand the silent progression of this disease. One of the first noticeable signs of cervical cancer is unusual vaginal bleeding. Let's delve into this symptom and understand why it occurs. Unusual vaginal bleeding is essentially any bleeding that occurs outside of your regular menstrual cycle. This could be bleeding after sexual intercourse, in between periods, or post-menopause when menstruation has ceased completely. But why does this happen? Well, as cervical cancer develops, it can cause changes in the cells of the cervix, the lower part of the uterus. These abnormal cells can cause irritation and inflammation, leading to sporadic bleeding. Unusual bleeding can also occur due to the tumor's growth. As the cancerous cells multiply and the tumor grows, it may invade nearby tissues or break small blood vessels, causing bleeding. It's important to note, though, that while unusual bleeding can be a symptom of cervical cancer, it can also be caused by other conditions, such as hormonal imbalances or certain infections. So what constitutes unusual bleeding? It's any bleeding that's different from your normal pattern. If you typically have regular cycles and suddenly experience spotting or bleeding between periods, that's unusual. Bleeding after intercourse or after menopause is also considered unusual. However, it's crucial to remember that not all unusual bleeding is a cause for alarm. There are many benign reasons why this could be happening, including hormonal changes, stress, or certain medications. But it's always a good idea to get any changes checked out by a healthcare provider, just in case. Persistent, unexplained vaginal bleeding should not be ignored. It could be an early warning sign. It's a symptom that demands attention and understanding, and while it may turn out to be caused by something completely unrelated to cervical cancer, it's always better to err on the side of caution. Remember, early detection can significantly improve the prognosis for cervical cancer. So don't dismiss unusual bleeding. Seek medical advice. Another symptom that might seem harmless, but could be a red flag, is changes in vaginal discharge. Now, vaginal discharge is a normal part of the menstrual cycle, acting as a vital housekeeping function in the female reproductive system. It carries away dead cells and bacteria, keeping the vagina clean and preventing infections. However, changes in its color, consistency, volume, or smell can be indicative of a problem, and in some cases it could be a symptom of cervical cancer. The primary cause of such changes could be an infection or inflammation, but it could also be due to hormonal changes, stress, or dietary changes. But when these changes in vaginal discharge are persistent, it could be due to a more serious condition like cervical cancer. So what kind of changes should raise your concern? First, let's talk about the color. Normal vaginal discharge often appears clear or milky and may have a slight odor. Its consistency varies throughout a menstrual cycle, but if the discharge appears pale, watery, pink, brown, bloody, or foul-smelling, it's time to consult a healthcare professional. Next, let's talk about the volume. An increase in the amount of discharge could also be a warning sign. It's normal for the volume to increase during certain times in your menstrual cycle, like ovulation, but if you're noticing a consistent increase, it's worth getting checked out. Lastly, if the discharge is accompanied by other symptoms like unusual vaginal bleeding, pelvic pain, or symptoms related to the spread of cancer to other organs, it's crucial to seek immediate medical attention. I want to emphasize that while changes in vaginal discharge can be a symptom of cervical cancer, they can also be due to a variety of other less serious conditions. So don't panic, but do take action. A simple appointment with your healthcare provider can provide a lot of clarity. Paying attention to such changes can lead to early detection and a higher chance of survival. Pelvic pain, another potential symptom, is often disregarded as a common women's health issue. Now let's talk about pelvic pain. This symptom, although common in various women's health conditions, takes on a more sinister significance when associated with cervical cancer. The pain could range from a dull ache to sharp twinges that may come and go or persist for longer periods. It is typically felt in the lowest part of the abdomen, between the belly button and the groin. So, why does pelvic pain occur in the context of cervical cancer? The answer lies in the progression of the disease. As cervical cancer advances, it invades the surrounding tissues and organs. This invasion can lead to inflammation and pressure on nerves, which our brain interprets as pain. In some cases, the cancer cells may also release substances that directly trigger pain receptors. It's important to note that pelvic pain can be linked to many conditions, not just cervical cancer. It could be due to menstrual cramps, ovarian cysts, endometriosis, or even urinary tract infections. Therefore, an isolated episode of pelvic pain may not be a cause for alarm. However, persistent or recurrent pelvic pain, especially when accompanied by other symptoms like unusual vaginal bleeding or changes in vaginal discharge, should never be ignored. If you experience such symptoms, it is important to consult with a healthcare provider. They can help determine the cause of your pain and guide you to appropriate treatment. Early detection is key in managing cervical cancer, and a symptom such as pelvic pain could be a vital clue pointing to an underlying issue. Remember, persistent pain is your body's way of alerting you that something might be wrong. When cervical cancer metastasizes, it carries with it a host of other symptoms. As cervical cancer progresses and spreads to other parts of the body, a process known as metastasis, the symptoms become more severe and varied. This happens because the cancerous cells invade healthy tissue in other parts of the body and disrupt their normal functions. The exact symptoms can be different for each person, as they depend on where the cancer has spread. For instance, if the cancer has spread to the lungs, one might experience shortness of breath, persistent cough, or chest pain. If the cancer has reached the bones, it could lead to bone pain or fractures. A common symptom, regardless of where the cancer has spread, is fatigue. This can be a result of the body's constant battle against the cancer, or due to the energy consumed by the rapidly dividing cancer cells. Another general symptom is unexplained weight loss. This can happen because the cancerous cells use up the body's energy supplies, or because they release substances that change the way the body makes energy from food. In some cases, the cancer may spread to the liver, leading to symptoms such as jaundice, a yellowing of the skin and eyes, or swelling in the legs and abdomen due to a buildup of fluid. When cancer spreads to the brain, it can cause a variety of neurological symptoms like headaches, seizures, or changes in personality or behavior. These symptoms signify advanced stages of the disease, underlining the importance of early detection. The sooner cervical cancer is caught, the better the chances of successful treatment and survival. Therefore, regular screenings are crucial. Remember, prevention is always better than cure. Now that we know the symptoms, let's talk about what we can do to prevent cervical cancer. The power of prevention lies in our hands, and in this case, it's as simple as getting a vaccine and routine screenings. The HPV vaccine is a powerful tool in our preventive arsenal. It protects against the types of human papillomavirus, or HPV, that most often cause cervical cancers. It's a significant leap forward in cancer prevention, and its effectiveness is astounding. The vaccine is highly effective at preventing infections with the HPV types covered by the vaccine, which are responsible for the vast majority of cervical cancers. It's crucial to remember, however, that while this vaccine is a significant line of defense, it does not protect against all types of HPV that cause cervical cancer. That's where regular screenings come into play. Regular screenings are a vital component of cervical cancer prevention. They allow for early detection, and early detection can dramatically increase survival rates. When cervical cancer is caught in the early stages, the 5-year survival rate leaps from 67% to an impressive 92%. These screenings are typically performed through a simple test known as a pap smear. This test can detect changes in the cervical cells that might become cancerous if not treated appropriately. It's a straightforward procedure that can make a world of difference in terms of prevention and early detection. So, there you have it. The power of prevention is in your hands. With the HPV vaccine and regular screenings, we can significantly reduce the risk of cervical cancer. Prevention is always better than cure, and in the case of cervical cancer, it's a lifesaver. Awareness is the first step towards prevention, but it doesn't stop there. It's not just about you, it's about everyone around you. It's about your mother, your sister, your daughter, your friend. It's about every woman who has a story to tell. It's about each one of us. When we talk about cervical cancer, we're not just talking about a disease, we're talking about a silent enemy that preys on the unsuspecting. An enemy that can be defeated by knowledge and timely action, and the responsibility to disseminate this knowledge falls on each one of us. The human papillomavirus vaccine, or HPV vaccine, has proven to be highly effective in preventing cervical cancer, yet many people remain unaware of its existence or its significance. That's where you come in. You can help spread the word about the vaccine and its importance in preventing cervical cancer. But the battle doesn't end with prevention. Regular screenings are crucial for early detection. The sooner the cancer is detected, the higher the chances of survival. A routine pap smear test can easily detect cervical cancer in its early stages, when it's most treatable. Yet many women skip these tests due to lack of awareness or fear. So encourage the women in your life to go for these screenings. Assure them that these tests are nothing to fear. They are, in fact, a tool for empowerment, a tool that gives them control over their own bodies and their own health. Also, remember that your voice has power. Use it to spread awareness about cervical cancer. Share the knowledge you've gained. Start conversations. Ask questions. Encourage others to do the same. You see, when it comes to fighting cervical cancer, we're all in this together. And together, we can make a difference. And lastly, don't forget about yourself. Get vaccinated. Go for regular screenings. Take control of your health. Because your health matters. You matter. Your voice can make a difference. It could save a life, perhaps your own.